What will happen to cognitive biases? Cognitive biases I'm talking about is that a lot of diagnosis depends on in what mood are we. And I'm sure you think mood se kya farak padta hai? I'm going to tell you what difference is going to make of how your psychology affects your diagnosis. Whether this psychological thing will be with them or with the eye or not, I'm not sure, because I can predict anything but future. So I'm not sure whether these robots will also start having ups and downs of moods and things like that. Sure enough, they can. This is a book which I recently read, and I love reading books. This book is known by the intelligence trap. Is why smart people do stupid things. And this is a small book which is about 200 pages. And it says, then when you become smart, then you become arrogant. You think, मेरे से बढ़िया डॉक्टर तो कोई है नहीं, और अगर मुझे लग रहा है ये टीबी है तो टीबी है, फिर ये कैंसर नहीं हो सकता. So many of us who are very smart commit stupid mistakes because we start thinking of ourselves as the infallible, and that's the start of the decline. Our rise is the cause of our decline most of the time, because you stop looking at the flowcharts, you stop listening to your juniors, and you think you're the only one who knows the best. So, of course, luckily you are not in that state, so I'm not going to talk about this a lot. Next is also dependent on this, and I have actually seen it happening in my life, and very painfully I have experienced that. What is mode denial? Mode denial is a state of psychological mind when you don't want to accept what is written on the wall, because उसके जो consequences है वो आपके लिए बहुत painful हैं. अमेरिका में जब ग्रेट डिप्रेशन अभी आया था तो उससे पहले सबको पता था कि आने वाला है, बट नोबडी एक्सेप्टेड दैट. दे केप्ट सेइंग नहीं नहीं ये तो ये है, ये तो ये, बट इट केम. आई रिमेंबर वन ऑफ द VIPs operated in Delhi for bariatric surgery, and next day he developed fever, he had rigidity, very clear cut telltale signs of leakage inside. And he should have been reoperated right then and there. He was not. They kept on thinking, antibiotic dete hai, ye karte hai, wo karte hai. Why? Because the surgeon who had operated was a very big surgeon. The patient who was operated was a very big politician. And the consequences was too high. If I as a surgeon diagnose that I operated and there is a leakage inside, that means problem was with me. And so dilly-dallying was done. This was mode denial. This will happen to you, to me. So very important, this will happen when you are treating VIPs, when you are treating your own relatives, especially relative. In one of the cases, long time back, a MD physician son came back and he said, Dad, I have pain. And ECG was done and it showed inferior wall myocardial infarction. A very mild 0.5 millimeter ST elevation. And we are all taught in MD that inferior wall changes will be very subtle. So the MD physician say, हाँ लगता तो यार ये myocardial infarction, लेकिन मेरे बेटे को कैसे हो सकता? I mean, your beta is no different than any other person. But because the consequences was very, so he refused to accept. He says, "ये कुछ इसका echo कराते हैं. चलो पहले किसी डॉक्टर को बुलाते." Another doctor was called who took his old time to come, and then they took him to the echocardiograph lab where he had a cardiac arrest and died. Young man. This is mode denial. That the writing is in the front, writing is on the wall. And you don't want to see it because the consequences are bad. And this will happen a lot of time, that you have made a diagnosis of tuberculosis in a person, and then there are signs that this is not tuberculosis, this is cancer. You will not accept it fast because you are in a mode denial. Never been in mode denial. The best way to deal with it is act right away. Whatever unpleasant things has to happen should happen. But at least the patient should be saved. Then there are patterns of diagnosis. Now another pattern is search satisficing. That means you are satisfied with the first explanation of your problem. उससे आगे बढ़ ही नहीं रहे. I give you an example. All of these things have happened with me, right? So you can understand how you learn. But it is always good to learn from other people's mistake rather than your own. But if you don't learn from your own mistake, then you are dumped. Then you are buried, right? Not only dumped but buried, right? So this patient came to me. He was a cardiac patient on aspirin, about 60-year-old chap, not 60, 55-year-old chap. And in routine tests, he was found to be anemic. Hemoglobin around 8.5, male. We investigated, it turned out to be iron deficiency anemia. Iron deficiency anemia in a male, it shouldn't happen. So we said, oh, but this is what happened to me. Search satisficing. I was satisfied to see an aspirin in his routine. And then, look, this is causing the gradual bleed. So let us stop this. So we did not investigate further. We stopped there, which is known as search satisficing. I was satisfied with the first answer I got and stopped there. Stopped aspirin, gave him iron, and within 3 months he became better. His hemoglobin was 14 and he was doing well. We thought we had won the war. That is also one of the lessons, that if the patient is improving on a particular treatment, doesn't mean that he has that disease. So again he had anemia. After 2 months his hemoglobin started falling again. Now this was a ghanti, this was a bell. So we investigated, we found a colonic carcinoma in him, and he got his colonic carcinoma operated. He's living today. So I don't have to live with the guilt that I killed one patient, though I've already had a lot of guilt. कि इतने patient को मेरी वजह से गड़बड़ हुई. You can't be 100% right. And then in many of the diagnoses you made in retrospect rather than prospect. So don't be satisfied with the first explanation you get. It is almost like घर में चोरी हुई है, एक मेड बाहर निकल रही है, आपने उसी को पकड़ लिया. तू नहीं चोरी करी, जबकि चोर तो काफी पहले निकल के भाग चुका. Second is representative heuristic. It's a very heavy word, but it means कि एक पैटर्न होता है बीमारियों का. तो अगर किसी को फीवर, बॉडी एक, लो प्लेटलेट है, तो आपको पता है कि ये डेंगू हो सकता है ना, पैटर्न होता है. So you are trying to diagnose on a pattern, which is not bad because काफ़ी सारी diagnosis हम पैटर्न से करते हैं, लेकिन हम इसी में फंसते भी हैं. And third is known as Occam's razor, where उनकी पॉलिसी ये है कि अगर आपको लगता है कि एक चीज़ 2 बीमारियों से हो सकती है, तो जो ज़्यादा सिंपल चीज़ है उसको डायग्नोज करो rather than जो ज़्यादा कॉम्प्लिकेटेड है. So these are different ways. And जो Occam's razor में लोग कहते हैं वो ये कहते हैं कि when you hear hoof beats, think of the horses, not of the zebras. कि जब आपको galloping की आवाज़ आ रही है तो zebras क्यों सोच रहे हो, horses सोचो, but sometimes there could be zebras. That's the problem with medicine, that there is no 100%. And so you got to keep your eyes open. So what should be done? We should take a diagnostic time out. अगर हमसे diagnosis ठीक से नहीं हो पा रही है तो हमको उस image को दूर से देखना पड़ेगा. Sometimes when you come very close to the picture looks blurred. So you have to stand aloof. And many times you can't do that. You have to call somebody else and ask him to look afresh to this problem. कि यार ये patient मेरे से नहीं diagnose हो रहा. You have come have a look. Many times it happens, हमने एक लेडी को हिस्टेरिकल कर दिया कि ये हिस्टेरिकल है. अब ये थोड़ी कि सारी चीज़ें उसके साथ हिस्टेरिकल ही होंगी. Hysterical lady can also have a myocardial infarction. Hysterical lady can have, so that kind. So take a diagnostic timeout when more than one people should look at the problem and should look at the thing कि हम जो diagnosis कर रहे हैं उसमें कितनी चीज़ें fit बैठ रही हैं और कितनी चीज़ें नहीं बैठ रही. What are the red flags? And my illustrious professor, Dr. Ellis, who taught me all the clinical medicine, told me once in one of the lectures, he says, yes, this is a dog barking, but this is not my dog. He was talking about diastolic murmur in mitral area, and he was saying, yeah, it is a diastolic murmur, it is not looking like a diastolic murmur of mitral stenosis, right? So that kind, so you got to have that kind of mindset in there.